My name is Stephanie Gonzalez, and this is my persuasive speech called The Urgent Need for Affordable Medical Care. Imagine this: you wake up with a sharp pain in your side. It's intense. You know you should go to the doctor, but you hesitate. Not because you're afraid of what it might be, but of, because you're afraid of the bill. Sadly, this is not an uncommon scenario in America today. I'm here to persuade you of something critical. The United States must improve access to affordable medical care. Every day we delay meaningful reform, real people suffer financially, physically, and emotionally. Let's start with the facts. The United States spends more on healthcare per person than any other developed country. Yet our health outcomes don't reflect that spending. According to the American Journal of Public Health, nearly two-thirds of all bankruptcies in the US are tied to medical debt. Think about it. Millions of Americans lose their homes, their savings, and their sense of security because they got sick. It's not just an economic crisis, it's a moral one. The problem is clear. According to the Chrysler Family Foundation, around 41% of adults in the US have some kind of medical debt. Roughly 30 million people remain uninsured. Even those who do not have insurance are often underinsured, meaning they are still left with massive out-of-pocket costs. Let me give you a real-world example. In 2022, a friend of mine went to the emergency room for what it turned out to be appendicitis. This surgery saved his life, but the $18,000 bill he received nearly ruined it. Even with insurance, he was left with over $6,000 in charges. He had no way to pay. That's not healthcare. That's punishment. The National Institutes of Health warns that delaying medical care due to costs leads to worse health outcomes, especially for people with chronic illnesses. When people skip preventive care, small problems become 67 big problems, ones that are harder and more expensive to treat later. So what can we do? The solution is not radical, as some make it to seem. We need to implement a system of affordable universal health care, a system where everyone, regardless of income or job status, can access the medical system services they need. Countries like Canada, the UK, and Germany have already done this. According to the World Health Organization, these countries spend significantly less per capita than the US, yet rank higher in life expectancy, maternal health, and overall access to care. A strong example of how this could work in the US, is spending Medicare or offering a public option. The Centers of Medicare and Medicaid Services reports that administrative costs under Medicare are significantly lower than those of private insurance companies, which means more money gets directly to patient care. Now, I want you to picture this. A single patient takes her child to the doctor without hesitation, knowing that the visit won't leave her behind on rent. A college student seeks therapy without worrying about going into debt. A retired couple no longer has to choose between prescriptions and groceries. Harvard Health Publishing has shown that preventive care and early interventions reduce long-term costs and improve public health. universal health care wouldn't just be ethical, it would be more efficient. Here's where you come in. Start by educating yourself on healthcare policy. Vote for leaders who support reform. Speak up. Share your stories. Help remove the stigma around needing help. The more we push together, the harder it is to ignore. Smaller steps matter. Even a conversation can lead to awareness, and awareness can lead to action. If we want a system that puts people over profits, we have to demand it. Today, we explored the severity of the medical debt crisis. We looked at universal health care as a proven, affordable solution. We imagine a country where people no longer fear the doctor's office. And we discuss how your voice can drive real change. In conclusion, affordable medical care should not be a privilege for the few. It should be a guaranteed right for everyone. Let's make sure that no American has to choose between their health and their future. Thank you. That is all.